Welcome to Connected by Health. I'm Dr. Krishna Vedala. This is where medicine meets leadership, innovation, and humanity with one goal: to add value and help change healthcare for the better. If you believe health is about more than a diagnosis, you're in the right place. Welcome back to Connected by Health. Today we're talking about one of the most surprising public policy stories in America over the past decade. It isn't about healthcare, it isn't about technology, and it isn't about artificial intelligence. It's about education, specifically what has become known as the Mississippi Miracle. For decades, Mississippi ranked near the bottom of nearly every national education ranking. It consistently had some of the highest poverty rates, some of the lowest education spending, and some of the lowest literacy outcomes. But then something unexpected happened. Beginning around 2013 and accelerating over the next decade, Mississippi became one of the fastest improving states in reading achievement. In 2023, national assessments showed Mississippi fourth graders ranked among the top states in reading, outperforming many wealthier states and becoming one of the few places where reading scores actually improved over time despite national declines. Supporters called it proof that education reform works. Critics argued the story is far more complicated. Today, let's examine both perspectives and ask whether healthcare can learn anything from this remarkable case. So, where Mississippi started. For much of modern history, Mississippi was viewed as one of America's most challenged states educationally. The state has long struggled with high childhood poverty, lower tax revenues, large rural populations, teacher shortages, historic racial inequalities, and limited access to early childhood education. For years, these challenges translated into low standardized test scores. The assumption across much of the country was simple: Mississippi would always remain near the bottom. But then, policymakers decided something had to change. So what were the reforms? What did policymakers put together? Around 2013, Mississippi implemented several major education reforms. And of course, the most well-known was the Literacy-Based Promotion Act. The law focused on one central idea: children who cannot read proficiently by the end of third grade face dramatically worse academic outcomes later in life. The reforms included universal early reading screening, additional reading coaches in schools, evidence-based phonics instruction, summer reading camps, individual reading improvement plans, teacher professional development, and perhaps most controversially, students who did not demonstrate minimum reading proficiency by the end of third grade could be retained before moving to fourth grade, with some certain exemptions. Supporters argued this prevented children from falling permanently behind. Critics argued retention could stigmatize students and disproportionately affect disadvantaged communities. So, what were the results? Well, the improvements became increasingly noticeable. Mississippi students improved steadily on the National Assessment of Educational Progress, often called the nation's report card. By 2022 and 2024, Mississippi fourth grade reading scores ranked surprisingly high nationally, especially considering the state's economic challenges. Research from multiple organizations noted that Mississippi's gains were among the largest in the country over the past decade. The National Assessment of Educational Progress supporters pointed to this as evidence that systematic literacy reform can improve outcomes even in high poverty rates. Some researchers argued Mississippi became a national model for evidence-based reading instruction. So why do supporters call this a miracle? Well, advocates argue several things happened simultaneously. First off, the state embraced the science of reading, emphasizing systematic phonics alongside vocabulary, fluency, and comprehension, rather than relying primarily on less structured approaches. Second, teachers received significantly more coaching. Third, schools identified struggling readers from much earlier, instead of waiting until middle school. Interventions began in kindergarten and first grade. Fourth, the reforms remained relatively stable despite political changes. Education policy often changes every election cycle. Mississippi largely maintained its literacy strategy over many years. The consistency may have been just as important as the reforms themselves. So what are some of the criticisms? Not everyone agrees this story is as straightforward as the headlines suggest. Several criticisms deserve serious consideration. First, some researchers argue improvements may partly reflect changes in student populations tested. Although the NAEP is designed to provide nationally comparable results, debates continue over whether differences in exclusion rates, demographics, or pandemic disruptions affected comparisons across states. Most analysts conclude these factors alone are unlikely to explain Mississippi's gains, but they remain part of the discussion. Second, third grade retention remains controversial. Research shows retention can provide additional instruction time for some students, but other studies suggest retained students may experience lower self-esteem, higher dropout risk, or social challenges if adequate supports are not provided. Most education experts now argue retention should never occur without intensive intervention. Third, reading gains do not necessarily translate into equally large improvement in every subject. Mississippi has improved in mathematics as well, but overall educational challenges remain. Graduation rates, workforce preparation, teacher recruitment, and college readiness continue to require attention. Fourth, Mississippi continues to rank near the bottom on many broader measures of child well-being, including poverty and health. Education improvements alone cannot eliminate structural challenges affecting children's lives. So, what can healthcare learn from the Mississippi Miracle? This is where this topic becomes very relevant for healthcare. Many healthcare reforms fail because they attempt to solve problems after they become severe. Mississippi focused upstream, early detection, early intervention, consistent measurement, evidence-based practice. Healthcare talks constantly about prevention. Education did exactly that. Rather than waiting until 8th grade to address literacy problems, Mississippi intervened in kindergarten. Imagine applying this philosophy more consistently to healthcare, screening for high blood pressure before heart attacks, treating obesity before diabetes develops, supporting maternal health before complications occur, investing in childhood mental health before crisis intervention becomes necessary. The broader lesson may be that systems improve when they identify problems early and respond consistently over time. So, was the Mississippi Miracle truly a miracle? Perhaps not. It may be more accurate to describe it as a long-term policy experiment with measurable successes and ongoing debates. Supporters see a powerful example of evidence-based reform producing real improvements in student achievement. Critics remind us that education cannot be reduced to a single test score and that broader social challenges still matter. Both perspectives contain important truths. One encouraging takeaway is that meaningful progress is possible even in places facing significant economic and social barriers like Mississippi. Whether in education or healthcare, sustained investment, early intervention, careful measurement, and a willingness to evaluate what works can make a measurable difference. The question isn't whether Mississippi has solved every challenge. It hasn't. There's still a lot of challenges left. The question is whether its experience offers lessons worth studying, and in my view, it does. Thank you for joining us here on another episode of Connected by Health. If you enjoyed today's discussion, please subscribe, share the episode, and leave a review. Together, we can keep exploring how education, healthcare, public policy, and community well-being are all deeply connected. Until next time, stay curious, stay informed, and remember, health and education are not competing priorities. They're investments in the same future, because at the end of the day, we're all connected by health. Thank you. If you found this conversation valuable, share it with someone who could use it. And if you're on Apple, we'd love to hear your favorite takeaway in a review. See you next week.